Hi, I'm Christy Turner. I will be discussing special populations from Chapter 9 of your personal trainer manual. Special populations, I'm going to go in order of our book. We are going to start with pregnancy first. Now, when it comes to rules and regulations that involve exercise for pregnancy, we look to the American College of Sports Medicine a lot, but we also will look to a group called ACOG, which is the American Council of Obstetrics and Gynecology. That's a physician-based specialty board, and a lot of these are very conservative guidelines. When I read through these, please have your client have a conversation with their physician about what their physician needs for their specific guidelines, because their physician could have more conservative or a little less conservative guidelines for that particular client. But as a rule of thumb, if a client comes to you and tells you that they are pregnant or diabetic or any of the following special populations we'll be discussing, please use your best judgment and always have them a physician's consent for these different disease states or special populations. Pregnancy is not a disease. Okay, most important concern when you're dealing with pregnancy is the safety and health of the mother and the baby. Regular exercise is highly recommended. It aids in easier labor and a quicker recovery. So doctors want their patients to be healthy and to be fit. There are certain things that need to be avoided just because of the growing fetus inside, and body positions can cut off blood supply or just not be comfortable for the mother or for the fetus. So we'll look at not being on your back, exercises on your back after the first trimester. So the first 3 months, you can be on your back, but after that, you really want to watch flat back laying. A lot of this has to do with a decreased level of oxygen to the baby. Also, because the baby is now taking a lot of the mother's nutrients, the blood, the oxygen, the calories, there's going to be a lesser level of fitness. It seems like there's going to be a higher fatigue rate. So keep that in mind with your clients. Also, as the body starts changing, balance is affected, so you want to choose exercises that support the changing body. Don't put a pregnant mother in a situation where she could fall. And in addition to prenatal exercise, you also want to look at the postpartum aspect, the healing aspect after the birth. And you want to base that a lot more on the woman's capability, the type of delivery that they had. What are they coming back from? A traditional birth, or did they have a C-section? Those healing rates are different. And always, post-birth, make sure you have a doctor's consent for that as well. And because of the baby needing more nutrients, please make sure you watch fluid consumption. Their fluid intake is very important to help fight dehydration during the workout. Now, when it comes to strength training, there's a lot of things a new mother will need to carry around, but we do have some specific guidelines that involve pregnancy. Most importantly, it's not encouraged for a pregnant woman to begin a rigorous strength training program after they become pregnant. A lot of people decide they want to, but toning exercises may be something better for them to focus on instead of starting a traditional weightlifting routine. So if a client does want to continue with their strength training, there's a few things to consider. You want to have them not do ballistic movements, so jumpy, bouncy, jerky movements. You want correct breathing. Avoid the Valsalva maneuver. You don't want those spikes and drops in blood pressure, because it's not just the mother functioning off that, it's the baby as well. Maximal lifts, you want to avoid those and focus more on endurance, 12 to 15 repetitions versus 8 or less. And you want to work on major muscle groups, at least 1 time per week for the major muscle groups. You don't really need to do a lot more than that. So we're not looking at strength training every single day or even 2 or 3 days a week. 1 is fine. I'm lying. 1 set of each major muscle group 2 times a week. I read that wrong. Also, machines are preferred over free weights, just the safety of the mother, the balance issues we talked about, dropping things, a bar, things like that. Just you can prevent that by not even having it be an option. Signs and symptoms for discontinuing pregnancy, or discontinuing exercise during pregnancy. Pain or bleeding, pubic pain, back pain, shortness of breath, dizziness or faintness, palpitations, rapid heart rates, and difficulty walking. This is, if they are feeling any of this, you stop exercising right now and encourage your client to go see the doctor. There, in your book, there is an extremely large table of issues that can come up with pregnancy. Just be familiar with this table, things to take into account that your client might be experiencing due to pregnancy. And because there are a lot of guidelines, there's some safe exercises that are highly encouraged, recommended. Not saying you have to limit to these, but these are safe exercises that you can feel comfortable having your client do, such as swimming, brisk walking, stationary cycling, not out there on the bicycle, stationary cycling, elliptical machines, step machines, low impact aerobics. All very safe, not incredibly high intensity exercises, but something that they can safely get a good cardiovascular workout. And as I mentioned, there are several things that are contraindicated for pregnant women. That means do not do them at any cost. Like exercises on the back after the first trimester, I mentioned the Valsalva maneuver. Also, the balance, making sure that they are safe and sturdy. Contact sports. Anything that could involve abdominal trauma. Jumping, hopping, those ballistic movements. Deep knee bends, full sit-ups, double leg raises, straight leg toe touches, anything that can mimic labor, that especially as the trimesters get later, you don't want to put the body into exertion in a labor-related position. And waist twisting movements, and make sure you avoid hot, humid weather. Temperature control is something that's a little hard to regulate as the body is changing size and shape. So our exercise prescription, this is during pregnancy, so prenatal, we're looking at a heart rate intensity of 60 to 70%, probably about 140 beats per minute. This is a range, and a doctor may have stricter or less strict guidelines, but as a rule of thumb, 60 to 70% is what is recommended. 3 times a week or every other day. Doesn't need to be all the time to see the benefit, just like our minimal cardiovascular training guidelines are. 15 to 30 minutes of cardiovascular exercise and 20 to 30 minutes of strength toning. So remember that strength training is very important for healing and for the demands of being a new mother. And again, the type in this in our exercise prescription will follow our frequency, intensity, time, and type. So for the type, low impact aerobics, cycling, swimming, and walking. Postpartum, we've got a little bit different. We're looking at a higher intensity because the mother is not supporting the baby anymore. There are greater caloric needs probably if she is breastfeeding, but the heart rate intensity can be 70 to 80%, 3 times a week, or every other day. They're still healing from a major event. And 15 to 30 minutes of aerobics, 20 to 30 minutes of toning, and low impact walking, swimming, cycling. So basically extremely identical to prenatal, except the intensity can be a lot higher.